Namaskar, very warm greetings to all of you. So, welcome to our new course, which is on motor imagery. I'm sure you must have gone through our previous slides in which I have described how to do motor imagery. What are the aspects of motor imagery? So, taking that forward, now we are going to start with pelvic floor strengthening through motor imagery. Okay, so आपने जैसे कि पिछले वीडियो में देखा होगा मोटर इमेजरी में दो मेन एस्पेक्ट्स होते हैं, वन इज विजुअल एंड अदर इज काइनेस्थेटिक. So since you are very clear, visual is all about visualizing or seeing yourself doing particular action, and kinesthetic is feeling that particular action taking place in your body. So for the pelvic floor strengthening, I have divided into 4 parts. So now we are going to start with the first part, where you'll be told about understanding of our basics. इसमें हम लोग क्या समझेंगे कि pelvic floor वास्तव में क्या होता है, what are the muscles, where it is located, and how it plays a very very important role in our urinary and bowel related problems. Okay, so let's move further. Okay, so one of the very very important thing that need to be understood here is that, pelvic floor is an important and essential part of our core muscles. I'm sure you all by now know what are our core muscles, how do we go about strengthening our core muscles. The course that we did in 2021 was all about Pilates based core strengthening. So if you look carefully here, this lower part where it is being mentioned pelvic floor, yes, this part, and here the diaphragm along with the abdominal muscles, they all work together, they all work as one unit, they are the core part of our body to bring about action. And what action do we talk about? It may be as simple as breathing action, it may be as simple as keeping your spine erect, it may be as simple as your bladder and bowel movements. So what needs to be understood is that all these muscles, they work together. ओके, सो हमने ये हमेशा याद रखना है कि हमारे जो पेल्विक फ्लोर मसल हैं, देयर आर वेरी मच हमारे कोर मसल्स का पार्ट हैं, एंड ये अकेले काम नहीं करते, इनके साथ डायफ्रामेटिक मसल्स हैं, इनके साथ एब्डोमिनल मसल्स हैं, इसके साथ हमारी लो बैक की सारी मसल्स हैं. दे ऑल वर्क टुगेदर टू ब्रिंग अबाउट डिजायर्ड एक्शन. ओके, मूविंग फर्दर, as I just said, all core muscles, they work in a coordinated manner. It is very very important कि इन सब में एक proper signal आए, उस signal की timing ठीक होनी चाहिए ताकि they can all work together as one unit. Okay, abdominal muscles have to go in. As you can see here, abdominal muscles have to go in, pelvic floor muscles have to go up. Floor, farsh, it's the floor of the body, it has to go up, and when they do that, they tend to push the diaphragm upwards, and when the diaphragm moves up, we all know by now which movement takes place? Expiration. Okay, when the diaphragm comes down, these abdominal muscles, they move out, pelvic floor muscles move down, and inspiration takes place. Okay, so we have to remember that the coordination between these muscles is very 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 important. Okay, so by now are you understanding a little bit of concept of pelvic floor कि वास्तविकता में ये मसल हमारा कहाँ लगा हुआ है और कैसे ये बाकी मसल्स के साथ मिल के एक कोऑर्डिनेटेड फैशन से एक्शन करता है. ओके, Moving next, so let's locate where are these pelvic floor muscles. If you see a human body from the front, आपका यहाँ पे कूला लगा होता है. ओके, यहाँ पे भी जिसको हम लोग पेल्विस कहते हैं, ठीक है, जस्ट उसके बेस में ये मसल्स लगे हुए हैं. अगर मैं पोस्टीरियर व्यू से देखूं तो व्हाट इज दिस पार्ट? दिस इज हमारा स्पाइन का बैक हिस्सा है. ओके, दिस इज आवर स्पाइन, इट कम्स डाउन स्ट्रेट, एंड दिस इज द सेक्रल पार्ट. सेक्रल के साइड से ये हमारी ये जो बोन लगी हुई है, इधर भी जो these bones are there, and in front also they join together to form pubic symphysis. Just उसके base में this is our pelvic floor. Just at bottom of it, उसके ऊपर हमारा कूला और the sacrum that we call rest कर रहा है. So is that clear? Where exactly is this muscle located? As you all know, motor imagery relies on your good imagination, but we cannot imagine anything if we haven't seen or heard, or we have any knowledge about it. So in this particular part, I am trying to make you understand what is a pelvic floor, where is pelvic floor located, so that you are able to memorize this and make a mental picture of it. Once you have a mental picture of it, we have already won half of our game. Okay, strengthening won't be really difficult task. What is important is, I understand most of you are not from medical background. However, these are the muscles we all feel. We all feel right from our birth. Okay, so it's very easy for you to localize it. Just you have to understand how the muscle bands are going and where is it located. Okay, yes, moving further. Now, these are the diagrams of a male and female body. If you can see, the pelvic floor, it lies at the bottom. Okay, so muscle, it has an origin point, it has an insertion point. So it is joined to this bony part, pubic symphysis here, and this, the coccyx part of our spine here. Okay, so between these two structure, it lies like a hammock, like a jhula. Okay, so on the bottom of our body, it is almost parallel to the earth. If you see, to the gravitational pull, it lies almost parallel to the earth, and both male and female, it runs from pubic bone till the coccyx. This is clear? Now, where does the difference lies? Males do not have uterus, all right? So the bowel is same, the rectal area is same. It pierces through the pelvic floor muscle. Then in females, we have the uterus, which lies between the bladder and the rectal area. This is your uterus part, and then is the bladder part. Males will have a prostate, this extra organ here, and then, so that means our pelvic floor is pierced at two places in males. दो जगह इस pelvic floor में passage होता है in males, that is your for the bladder, and other is for your rectum. In females, we have three places for the bladder, for the uterine area, and for the rectal area. ओके, सो ये चीज़ आपको क्लियर हुई कि ये कहाँ नीचे लगा हुआ है, मेल एंड फीमेल में क्या बेसिक डिफरेंसेस होते हैं इन द पेल्विक फ्लोर. ओके, नाउ आई होप दिस डायग्राम इज एबल टू शो यू बेटर हाउ पेल्विक फ्लोर इज एग्जैक्टली लोकेटेड. आप समझ पा रहे हैं, ये हमारी पीछे से स्पाइन दिख रही है. दिस इज अ बैक व्यू, हम पीछे से देख रहे हैं, रीढ़ की हड्डी जा रही है. वी हैव अ sacral bones, and then on the bottom of it there is a hammock kind of structure which is our pelvic floor muscles. Okay, all right, moving next. Now we've seen pelvic floor नीचे लगा हुआ है. We have 2 or 3 opening depending on whether it's a male body or a female body. Now when you know the structure is under the constant pull of the gravity, हर समय धरती इस muscles को नीचे अपनी तरफ खींचने की कोशिश कर रही है. So definitely these are supposed to be strong fibers, and they should have a strong supported structure so that it doesn't give away. Okay, so this diagram is just to let you know how strong these structures are. The main, see, the main pelvic floor muscles, puborectalis, pubococcygeus and iliococcygeus. You don't have to go into the names of those, but this is just and just to make you understand कि ये हम लोग ऊपर से देख रहे हैं. ठीक है, हमने वो pelvis लिया, पहले हमने पीछे से देखा, फ्रंट से देखा, अब हम क्या कर रहे हैं, ऊपर से देखें अगर pelvis को, तो हमें क्या दिखेगा, पीछे ये रीढ़ की हड्डी दिखेगी. दिस इज अ सेक्रल पार्ट, यहाँ से ऊपर स्पाइन जा रही है, ये आगे हमारा प्यूबिक सिम्फिसिस वाला एरिया हो गया. अब हम इसको ऊपर से देख रहे हैं. इट्स लाइक अ बोल, इट्स लाइक अ कटोरा जिसका नीचे के बेस में वी हैव the openings and we have these main muscles, levator and eye muscles, and if you see their location, आप ये देख रहे हो हमारी जो जो opening थी उसको साइड से इन्होंने reinforce कर रखा है. Such strong fibers which run in this direction to reinforce the opening, ताकि हम लोग बहुत easily अपना action of defecation or maturation in females for the childbirth, ये सारे actions easily कर सके. इसलिए ये muscles आप देखेंगे कितने strongly and at a particular angle हमारी body के साथ लगे होते हैं. ठीक है. उसके अलावा इनको स्ट्रेंथन करने के लिए वी हैव प्री रेक्टल फाइबर्स, वी हैव देन levator hiatus, we have obturator internus, we have tendinous arch of levator ani. There are, see this curved structure. So basically there are lots of structures, lots of fibers, lot of tendons, lot of bones here and there. They all basically work together to form a strong structure and to support the vital internal organs. Is that clear? Okay. So अगर हम देखें इसका action, so you can see this is how these muscles, main levator ani, this is how the main levator ani muscles, see that, and this one. Okay, now can you appreciate वो जो मेन लिवेटर इन आई मसल्स थे वो कैसे कॉन्ट्रैक्ट कर रहे हैं टू ब्रिंग अबाउट द एक्शन ऑफ मे बी यूरिनेशन और डिफिकेशन. ओके, सो दिस इज हाउ द मसल्स आर कॉन्ट्रैक्टिंग. और जो हमारी वो ओपनिंग्स है वो छोटी बड़ी, कॉन्ट्रैक्ट, रिलैक्स, ओपन, क्लोज, जो भी आप टर्म बोले, दैट मूवमेंट कीप्स हैपनिंग. ओके, सो प्लीज अंडरस्टैंड दिस पर्टिकुलर एक्शन अंदर की तरफ खींच रहा है. एंड इफ वी गो बैक टू आवर प्रीवियस स्लाइड्स, pelvic floor when it comes up, then the abdominal muscles also, this goes up, abdominal muscles also come inside. So I want you to take a second and please feel this movement. कैसे आप pelvic floor को भी ऊपर कर रहे हो. Just contract these muscles, just contract these muscles around your urinary area, around your rectal area, around your vaginal area, and also contract your abdomen inside. Sit erect, back absolutely straight, and feel the lower muscles coming up, abdominal muscles going out, and at the same time you can assist this movement by breathing out. Fantastic. Come on, let's do it couple of times. Contract the pelvic floor muscle, contract the abdominal muscles, and breathe out. Okay, then again contract the pelvic floor muscle, contract the abdominal muscles, and breathe out. Okay, this was the main action. This is a motor imagery case. I know some of you might be having weak pelvic floor muscle, does not matter. Till you are able to memorize its action, till you are able to memorize its location, till you are able to imprint this picture in your mind, जब तक आप ये सारी चीज़ें, ये सब कुछ अपनी मेमोरी, अपने डेटाबेस, अपने ये वाला जो स्ट्रॉन्गेस्ट डेटाबेस है इसमें आप डाल सकते हो, we are winning over this situation. Okay, so absolutely clear. बेस पे लगा हुआ है, ग्रेविटी ऑलमोस्ट ग्रेविटी के पुल के हमेशा पैरेलल लगा हो, तो इट्स ऑलवेज हैज टू वर्क अगेंस्ट द ग्रेविटी, एंड व्हेन इट कंट्रैक्ट्स द एब्डोमेन मसल्स आल्सो. ओके, मूविंग नेक्स्ट. सो लेट्स मेक अ मेमोरी. जो जो हमने अभी बताया है उसको हम रिवाइज करेंगे. सो व्हाट वी नो, व्हाट इज द करेक्ट एक्शन? व्हेन द pelvic floor goes up, abdomen goes in. Okay, it is never the other way out. Abdomen goes in, pelvic floor has to come down. So this coordination जब हम memorize वाला भी करेंगे, we'll always remember, if my pelvic floor is going up, my abdominal is also going up. Fantastic. Remember, a good memory will only bring good results. So just memorize. I know we have different levels of abilities, but understanding we all have good understanding. I have evaluated most of you, so I know you people are cognitively smart enough to understand this. मुझे पूरा विश्वास है आप बहुत अच्छे से इस कॉन्सेप्ट को समझ पा रहे हैं. सो दिस इज़ वेरी वेरी इंपॉर्टेंट कि आप एक अपना जो स्मरण शक्ति में जो चीज़ डाल रहे हैं, जिसको आप याद कर रहे हैं, वो बिल्कुल परफेक्ट मूवमेंट होनी चाहिए. ऐसा मत करिएगा कि हम एक रॉन्ग मूवमेंट को याद कर रहे हैं एंड रॉन्ग मूवमेंट के थ्रू अपना मेमोरी डेटाबेस बना रहे हैं. ठीक है. सो हाउ विल वी डू अबाउट इट? पेल्विक फ्लोर ऊपर आएगा, पेट हमेशा अंदर जाएगा. जस्ट रिमेंबर दिस. अप इन, ऊपर अंदर एंड ब्रीदिंग आउट. इज दैट सिंपल इनफ? ऑलराइट, लेट्स मूव फर्दर. सो जैसे कि मैंने आपको पहले बताया, देयर आर टू टाइप्स ऑफ मोटर इमेजरी. वन इज विजुअल, बंद आंखों से देखना, एंड सेकेंड इज बंद आंखों से फील करना. So we see with the closed eyes, and second is we feel with our eyes closed. Okay, so happy days are here again. We have to say goodbye to the diapers. We are not going to use diapers, but what we are going to do is we are going to memorize all those happy days. We are going to now just go back to your photo albums or your whatever digital ways you have saved your pictures. Just see the days when you used to go out easily without worrying about finding a toilet, without worrying about wearing a diaper or anything. Okay, so just memorize those days कि कैसे एक perfect तरीके से आपके pelvic floor muscles contract करते थे, साथ में abdominal muscles अंदर आते थे, and you never had leakage issues. Okay, वो चीज़ों को याद करेंगे, पुरानी पिक्चर्स याद करेंगे जो आप लॉन्ग ट्रिप्स में गए थे, when you didn't have to worry about a washroom or even a diaper. Just memorize those days and relate with those days कि उन दिनों में क्या होता था. You did not use any kind of diaper and you had a good control over your bladder. Alright, so keep memorizing, keep imagining, keep improving every day. Mental rehearsal is very very important till we meet again.